For more now, let's bring in Dr. Eric Cioe-Pena. He's the director of global health at Northwell Health. Right off the bat, Dr. Pena, people are worried, and those fears seem to be increasing rapidly. Are there any myths about the coronavirus that you would like to clear up?
I mean, the big myth right now, Lana, thank you for having me, is that this is a virus that is going to be deadly in the majority of people. I think Americans are very afraid right now that if they get the virus, they have a high chance. We're hearing about all the cases getting admitted to the hospital and being killed. You know, this is a virus with a very low mortality, and the majority of Americans, greater than 99%, much greater than 99%, are going to be fine resting at home.
All right, so let's talk facts. How long does it take somebody who's infected to begin developing symptoms?
So, you know, the quarantine is for 14 days. The average, though, the median is about 5 days. 5 to 7 days is what the incubation period is between getting infected and getting symptoms.
And what are the first symptoms?
So first symptoms are usually upper respiratory infections, so runny nose, cough, developing into a fever. And then in a very, very small subset of people, a lower respiratory tract infection, so wheezing, difficulty breathing, pneumonia.
Is there any way to tell the difference between those symptoms and a common cold or the flu? Or do you need a hospital test?
Not really. And so for the majority of people, we tell people you don't need a hospital test, because if you're feeling fine, resting at home, it doesn't matter whether you have the flu or the coronavirus, you're going to be fine. The important thing is that people who are at risk, who are medically fragile and have lung diseases, or are elderly, who are at risk of having more serious consequences that we're seeing in this outbreak, need to come in and get tested when they're at the point where they are having difficulty.
How does the coronavirus spread?
So coronavirus is a droplet virus, just like the flu or common cold. It's little respiratory particles that land on surfaces. We then touch those surfaces or shake hands and then touch our mouths and transmit the virus. It comes in through the respiratory tract of our mouth, nose, and then infects the rest of our body. And so that's the main method of transmission. It's not airborne, and so the casual contact does not lead to transmission. So walking by someone that has coronavirus is not going to get you sick.
How long does it live on surfaces?
It's hard to tell. It depends on how wet the surface stays or how humid the environment is. Usually, by the time the surface is completely dry, it's dead. But we've seen viruses that get killed after several hours, up to several days.
And how long is somebody with the virus contagious? And can they spread it without even knowing that they have it yet?
So yes, I mean, everyone who has it can be mildly contagious. The most contagious time is when you are febrile, when you are having symptoms. That's the time where the viral shedding that you have in those little droplets is the highest. So you're at the highest risk of transmitting it when you're symptomatic, but there's a small risk of transmitting it before and after symptoms. That's why we tell people to wait 24 hours after their symptoms resolve to go back to work or school.
If you recover from coronavirus, do you then have immunity?
So we think so. I mean, there's been a couple of cases where that's there's been exceptions to that, but they're the exception in 84 or 95,000 cases. Majority of people that recover are not getting sick again, and they're still in an area where they'd be exposed. So you are immune to this strain of coronavirus after you've developed symptoms.
The World Health Organization says that the death rate is 3.4%. Is that considered especially deadly?
It is. I think the World Health Organization is overestimating the death rate right now. I think that our surveillance isn't very good. So there are a lot of healthy people that are developing coronavirus with mild or moderate symptoms that aren't getting tested. So our denominator's wrong. In places like South Korea, where we've seen really good testing, we've seen a death rate closer to about 0.5%, which is much less. So I mean, definitely any excess death is one too many, but I don't think this is as deadly as it's being advertised.
Well, that's at least a little bit of encouragement. Next question. Do you expect that this virus will stick around, or should we expect that it is, in fact, seasonal?
It's too early to tell. And, you know, this may just kind of go through all of our communities, become widespread, and then disappear and never reappear again. It may develop a seasonality to it, and it's really hard to tell. We're going to have to just see over the next couple of months kind of how this progresses.
Thank you so much for answering my slew of questions. I have one last one for you.
Sure.
Can you actually give us a reality check? Obviously, people with underlying health issues and the elderly are most at risk. But what about people who are otherwise basically healthy, children, babies?
So the good thing that we've seen about this virus is there's almost no pediatric mortality or serious pediatric morbidity. So kids, especially young children, unlike the flu, which is deadly in that population, this seems to be sparing that population. The elderly, we are seeing some complications. But for young, healthy individuals without any chronic medical conditions, this is a virus that you're most likely going to recover from in your home.
We know that washing your hands, sanitizing, and keeping yourself clean and not touching your face or your mouth generally is the advice that people have been given, as well as stay home if you're sick, which I want to reiterate
Correct.
to everybody. Is there anything else that you would recommend to Americans to protect themselves?
I mean, disinfect surfaces that are touched by multiple people in your household. So doorknobs, faucets of sinks, things like that. Those are common sense ways, and it doesn't have to be fancy. Any household disinfectant will work. You don't have to go and buy something special. And then washing your hands before you eat, remembering as much as possible not to touch your face, or at least to wash your hands before you do so.
Dr. Eric Cioe-Pena, thank you for all of those informative answers.
My pleasure. Thanks for having me.